What is a CT scan? CT stands for Computed Tomography, an advanced medical imaging technique that provides doctors with detailed views inside the human body. CT scanning combines multiple X-ray measurements taken from different angles around the body to create cross-sectional images. Unlike traditional X-rays that produce a single flat image, CT scanners rotate around the patient, taking hundreds of X-ray measurements from different angles. Let's compare traditional X-rays with CT scans. An X-ray provides a single two-dimensional image where all structures overlap. In contrast, CT scans create multiple cross-sectional images or slices of the body. These slices can be viewed individually or combined to form detailed three-dimensional representations. CT scans provide remarkable clinical value by allowing doctors to see inside the body with exceptional clarity without invasive procedures. These detailed images enable physicians to diagnose injuries, tumors, and other abnormalities with greater accuracy, and to plan surgeries and treatments with precise information. The physics behind CT scanning is based on how X-rays interact with different tissues in the body. A CT scanner rotates around the patient, taking multiple X-ray measurements from different angles. The fundamental principle of CT is that different tissues absorb X-rays to varying degrees based on their density. Let's examine how X-rays interact with three different tissue types: bone, soft organs, and air-filled spaces. Dense tissues like bone absorb a high percentage of X-rays. When fewer X-rays reach the detectors, these areas appear white on the final image. Medium-density tissues like organs absorb a moderate amount of X-rays, appearing as various shades of gray. Air-filled spaces absorb very little radiation, allowing most X-rays to pass through. These areas appear black on the CT image. From these differential X-ray absorption measurements, the computer reconstructs a cross-sectional image. In the final CT image, dense bones appear white, organs appear in various shades of gray, and air-filled spaces appear black. These differences in contrast are the foundation of CT scanning, allowing radiologists to distinguish between tissue types and identify abnormalities such as tumors, bleeding, or infections. The CT scanner captures these differential absorption patterns from hundreds of angles to create detailed cross-sectional images of the body. A CT scanner consists of several key components working together to create detailed cross-sectional images. The main components include an X-ray tube, detectors, a motorized patient table, and a computer system for image reconstruction. The CT scanner's cylindrical gantry houses the X-ray tube and detectors, which rotate around the patient during scanning. The X-ray tube is a critical component that generates the radiation needed for imaging. It contains a cathode that emits electrons and an anode target. When electrons hit the anode, they produce X-rays. The X-ray beam emerges from the tube and passes through the patient's body at different angles as the tube rotates. Modern CT scanners use high-performance X-ray tubes capable of rapid rotation and consistent output during the scanning process. The detector system is positioned opposite the X-ray tube to capture the radiation after it passes through the patient. As X-rays travel from the source to the detectors, they are attenuated differently by various tissues in the body. These detectors measure the intensity of the radiation that reaches them, creating data points that will be used to reconstruct the final image. Each detector element typically consists of a scintillation crystal that converts X-rays to light, paired with photodiodes that convert that light into electrical signals. The patient table is a motorized platform that moves the patient through the scanner gantry. The table provides precise computer-controlled movement during the scanning process. Modern tables can support patients of various sizes and move with sub-millimeter precision to ensure accurate image acquisition. Modern CT tables can support patients weighing up to 300 kilograms and position them with sub-millimeter accuracy. The computer system is the brain of the CT scanner, processing the raw data from the detectors and reconstructing it into diagnostic images. It uses sophisticated algorithms to transform the data collected from thousands of projections into detailed cross-sectional images. Modern CT computers can process enormous amounts of data and perform reconstructions in seconds, allowing for rapid diagnosis. Today's CT systems utilize powerful multi-core processors with up to 128 gigabytes of RAM, capable of reconstructing over 40 images per second. Modern CT scanners use multi-slice technology with multiple rows of detectors to capture many images simultaneously. Traditional single-slice CT scanners capture only one slice of data per rotation of the X-ray tube. In contrast, multi-slice CT scanners have multiple rows of detectors that can capture up to 320 slices in a single rotation. This technology offers numerous benefits, including faster scanning times, improved spatial resolution, reduced motion artifacts, and better volume coverage. The technology has evolved rapidly from four-slice scanners in the 1990s to today's advanced systems with up to 640 slices per rotation. During a CT scan, the patient lies on a motorized table. The patient must remain still during the scan to ensure clear images. The table slides into the scanner's circular opening, known as the gantry. Inside the gantry, an X-ray tube rotates around the patient while emitting X-ray beams. The X-ray tube emits beams that pass through the patient's body. As these X-ray beams pass through the body, they're attenuated or weakened to varying degrees depending on tissue density. Detectors on the opposite side measure this attenuated radiation. The table incrementally moves the patient through the scanner to capture images of different sections, creating cross-sectional slices. These slices are then processed to create detailed cross-sectional images of the body's internal structures. This scanning process allows radiologists to examine the body in slices, providing valuable diagnostic information without invasive procedures. During a CT scan, the X-ray tube rotates around the patient's body, collecting data from multiple angles. As the tube rotates, it takes hundreds of measurements from different angles. These measurements represent the attenuation profiles of X-rays passing through the body. The computer system collects these raw data points, often millions of them, during a complete scan. This raw data requires sophisticated mathematical algorithms to be converted into the cross-sectional images that physicians can interpret. Two main algorithms are used for reconstruction: filtered back projection, which is faster, and iterative reconstruction, which can produce higher quality images with less radiation. Filtered back projection works by taking the attenuation profiles from all angles and mathematically projecting them back through the image space. When data from all angles is combined, a cross-sectional image is formed, revealing internal structures with different densities. This conversion from raw data to meaningful medical images is the foundation of CT technology, enabling physicians to visualize internal structures in great detail. CT images are displayed using Hounsfield units or HU, a quantitative scale that represents tissue density in CT imaging. The Hounsfield scale is named after Sir Godfrey Hounsfield, inventor of the CT scanner. On this scale, water is assigned a value of 0 HU, which serves as a reference point. Air has a value of approximately negative 1,000 Hounsfield units, and dense bone can be positive 1,000 HU or higher. Most soft tissues in the body fall between 0 and 100 HU. Organs like the liver, spleen, and muscle have characteristic density values. Radiologists can adjust window settings to optimize visualization of specific tissues. Window settings consist of two key parameters. Window width controls the range of displayed Hounsfield units, affecting the contrast of the image. A narrow window width results in higher contrast. Window level, or center, defines the midpoint of the displayed range, which adjusts the brightness of the image. It's centered on the tissue of interest. Different specialized window presets are used to examine different body structures. Each preset is optimized to display specific tissues. Bone windows use a high center value and wide width to properly display the full range of bone densities, from cancellous to cortical bone. Soft tissue windows use a narrower width centered near plus 50 HU to maximize contrast between organs and other soft tissues. Lung windows are centered at negative 500 HU with a wide width to visualize the air-filled lungs and detect subtle abnormalities. Brain windows use a narrow width centered near 40 HU to maximize contrast between gray and white matter in the brain. The same CT image can look dramatically different when viewed with different window settings. Here's how a head CT might appear with 3 different presets. Bone windows make the skull and other bony structures clearly visible, but soft tissues appear washed out. Soft tissue windows allow radiologists to evaluate the brain parenchyma, ventricles, and other soft tissue structures. Lung windows are used to examine air-filled spaces and can detect subtle abnormalities like small nodules or early emphysema. Understanding Hounsfield units and window settings is essential for radiologists to accurately interpret CT images and detect pathologies across different tissue types. Contrast enhancement is a vital technique used in CT imaging to improve visualization of specific structures. Contrast agents are specialized iodine-based compounds that temporarily alter how X-rays interact with tissues and fluids. Contrast agents can be administered through 3 main routes. Oral administration is used primarily for imaging the digestive tract. Intravenous administration is the most common method, allowing contrast to circulate throughout the body. Rectal administration via enema is used specifically for examining the colon. Contrast agents work by temporarily changing how X-rays interact with tissues. In standard CT images, certain structures like blood vessels and some lesions may be difficult to distinguish from surrounding tissues. When iodine-based contrast is added, these structures become much more visible due to increased X-ray attenuation, appearing brighter on the CT image. Contrast enhancement is crucial for many clinical applications in CT imaging. In vascular imaging, contrast agents highlight blood vessels, making it easier to detect aneurysms, stenosis, and other vascular conditions. For tumor detection, contrast helps differentiate abnormal tissue from normal structures due to increased blood flow and vascular permeability in tumors. Contrast is also essential for assessing organ function, allowing visualization of perfusion patterns and excretion rates in organs like the kidneys and liver. The timing of image acquisition after contrast administration is crucial for capturing specific phases of contrast enhancement. CT scans can be timed to capture different phases of contrast distribution. Pre-contrast images are taken before any contrast is administered. The arterial phase occurs approximately 15 to 20 seconds after injection, when contrast is primarily in the arteries and highly vascular structures. The venous phase follows at about 40 to 60 seconds, showing contrast in the veins and solid organ enhancement. The delayed phase, occurring minutes after injection, is useful for visualizing structures like the biliary system or urinary tract, as contrast is excreted. Accurate timing is crucial, as scanning too early or too late may miss important findings or lead to misinterpretation of the images. CT scans use ionizing radiation to create detailed images, which is an important consideration in their clinical use. Ionizing radiation from CT scans has enough energy to remove electrons from atoms, which can potentially damage cells and DNA. The radiation dose from a CT scan is significantly higher than conventional X-rays, ranging from 2 to 20 millisieverts depending on the examination type. Modern CT scanners incorporate several technologies to reduce radiation dose while maintaining image quality. Automatic exposure control dynamically adjusts radiation output based on the patient's size and tissue density. This can reduce dose by 20 to 40% while maintaining diagnostic quality. This technology automatically adjusts radiation intensity to different body regions, using less radiation for thinner areas while ensuring adequate exposure for denser regions. Iterative reconstruction algorithms process image data multiple times to reduce noise while using lower radiation doses. This advanced processing can maintain or even improve image quality while reducing exposure. This algorithm starts with a noisy, low-dose image and progressively refines it through multiple computation cycles, resulting in a clearer image without additional radiation. Beam filtration uses specialized hardware to shape the X-ray beam according to patient contours, reducing scatter radiation and unnecessary exposure to sensitive organs. Beam filtration focuses radiation precisely where it's needed, eliminating unnecessary scatter radiation that doesn't contribute to image quality. Radiologists follow the ALARA principle, as low as reasonably achievable. This guides all decisions about radiation exposure in medical imaging. The ALARA principle is implemented through multiple strategies. These include tailoring protocols to individual patients, limiting scan range to only the area of interest, considering alternative imaging methods, and using appropriate shielding when possible. For each CT examination, radiologists carefully weigh the diagnostic benefit against the potential risk from radiation exposure. The benefits include accurate diagnosis, early detection of disease, guiding appropriate treatment, and often avoiding more invasive procedures. The risks are primarily related to a small statistical increase in cancer risk, which is higher for children and varies by the body region being scanned. In clinical practice, CT scans are only performed when the diagnostic benefit clearly outweighs the small potential risk from radiation exposure. To summarize, modern CT scanners incorporate multiple dose reduction technologies, following the ALARA principle to minimize radiation exposure while maintaining diagnostic quality. Scan protocols are carefully tailored to individual patient characteristics, and CT examinations are only performed when the diagnostic benefit clearly outweighs the potential risk. Ongoing technological advances continue to reduce the radiation dose required for high-quality imaging, further improving the risk-benefit profile of CT scanning.